Thank you, Paul. Thank you, Rory, for having us, and thank you all for coming. I'm going to focus a little bit on liver disease because this session's entitled How Researchers Use the Data. I am the least qualified researcher in the room. I'm a practicing doctor, so I'm good at broken bones and heart attacks. If you give me statistics, I have the broken bones and the heart attacks. That's my role. I'm going to assume no prior knowledge because we have a room full of researchers. So in liver disease, the nomenclature has a lot of Latin, but not a lot of practical association. So in 1970, in Jewish and Muslim communities that didn't drink much, it was identified that people were getting a lot of liver disease that couldn't be alcohol related, but was due to their diet. And this then got termed over time non-alcoholic steatohepatitis because these were the histological features of that disease, and this is the progression of that disease. Now, it was quite rare in the 1970s. I was born in 1977. It's now quite common. In fact, this is the commonest liver disease worldwide, and it's a big public health problem, and it affects approximately, from steatotic liver disease, 30% of Western populations, and steatotic liver disease with inflammation is between 5 and 8% of Western populations. In Mexico, children under the age of 10, 4% already have steatohepatitis. Now think of that for a second. Their developmental milestones, their school performance, their skeletal structure will all be affected by that. Now, I was a cardiology registrar who, in order to get a consultant job in the south of England, had to do a PhD and learn how to do cardiac MRI, mainly because I was rubbish at echo. In the course of that, if anybody here does cardiac MRI, in the bottom left corner of your short axis stack of cardiac images, you capture the liver. Now, normally that's the corner of the screen that you ignore, but it's static, it doesn't move, it doesn't have a lot of the problems of heart imaging, and so it's actually easy to do quantitative analysis on. At the time, this was 2008 in Oxford. Sorry if this is a bit of a history lesson, but that's how long UK Biobank goes back. Oxford had developed not just spectroscopy, but methods of tissue characterization for fat, inflammation, fibrosis, and also iron content, some of the stuff that Louise alluded to just now. And what we found was we didn't want to biopsy hearts to confirm that we were measuring the right things, but it was okay to biopsy livers because the doctors upstairs who like big needles were doing that already. And we found that we could predict the findings of a liver biopsy. Now that was quite interesting for us, and what was really interesting was in the same year, Dame Sally Davies, then the chief medical officer, labeled the epidemic of fatty liver disease as one of the big public health threats. And so Oxford's developed a test for liver disease. The chief medical officer of the UK says it's an important thing. Rory graciously put it into UK Biobank. And in a nutshell, and this is what most GPs in the UK are now learning, instead of a liver biopsy with a 2.4% risk of major complications, you can do the liver component of UK Biobank, which is actually only 3 minutes, which can give you the same data. And this is what the reports look like. Now, none of this would have been possible without UK Biobank, because the first thing GPs want to know is, have you done this on tens of thousands of people in the UK? Well, actually, we have. As of, I think, last week, you've done it on 100,000 people in the UK. And all of them, or such that the data has been uploaded to the cloud, I think about 45,000 or maybe 60,000 now, have had these reports. But what it meant for the larger health and clinical trials community is if you had a therapy for a condition, this is steroids and autoimmune hepatitis, for example, you didn't have to biopsy a patient every time you wanted to find out if your treatment was working. So here you can give steroids to a patient with autoimmune hepatitis, and after 12 weeks you can taper down the steroids. This is like lung function testing for a person living with asthma. You don't have to treat indefinitely with a treatment that could be harmful. The BMJ, actually with some Austrian authors so we don't get too jingoistic, then labeled this as quite a useful improvement. Perspectum doesn't have a marketing department, so we quite like Austrian academics because they called us the virtual biopsy. And at the same time, we carried on publishing with the University of Westminster, Jimmy, Louise, Paul, and others. So thank you to everyone in UK Biobank that continued to upload data. And I wanted to show these because these population statistics are two of the most frequently seen graphs by UK GPs inquiring about liver scans, because they have a test result and they want to place their patient on these graphs. And I told you I was a reluctant researcher and not a very good one, but this is the output, I feel, of all the research that you and many others outside of this room have contributed. Practicing doctors today have certainty on whether they can reassure or escalate someone's care based on the work that you have done here in this room. So this is UK Biobank overlaid with some data from the US where people are much more biopsy friendly. And we can now categorize liver disease in the UK. The top right has steatohepatitis. We haven't yet invented a scan that tells us how much you're drinking, so I don't call it metabolic or alcoholic or either of those. But that is treatable liver disease with inflammation. And we published earlier this year that you can track patients over time with biopsies, and the imaging predicts the biopsies. So now that has gone to the MHRA, the EMA, and the FDA, so that instead of clinical trials using biopsies as their phase 3 endpoints, they can use the imaging developed by UK Biobank. And helpfully, the world's biggest pharma company now, Eli Lilly, completely agrees with it. They say we should definitely do this, and since they're the biggest funder for medical research in obesity at the moment, that kind of helps, and hopefully that's useful for Rory and his team when they come to getting follow-on funding. How has UK Biobank helped Lilly? Well, this test that wouldn't have existed without UK Biobank is the test that shows that Lilly's drug tirzepatide, marketed as Mounjaro, can treat MASH. And so they are now in a dialogue with the FDA of how can they do this in a phase 3 study in the United States to get market approval there. There was a UK Biobank a milestone slide that Dawood showed. This is our evolution in parallel with that. So we were spun out after my PhD in 2012 at the request to be able to put a product into UK Biobank that would then get CE marked. Years later, my colleague Elizabeth Shumbayawanda, who I put here above a picture of Daley Thompson because I genuinely think she has more endurance, published a 9-year European Horizon 2020 funded health economic study which showed that MRI at the front end was cost effective versus all sorts of inaccurate medicine, ultrasound, blood tests, etc., etc. This is really the clinical demonstration of the research ethos of UK Biobank. Do what's right, not what's cheap, and you have a chance of being effective. If you do what's cheap, but definitely not right, you will never be cost effective. More also to the point, Oxford is the home, of course, of one of the homes, I guess, of William Osler. This is Oslerian-style medicine coming from Oslerian-style research. Do the right thing and worry about the patient one at a time. Now, life comes full circle. I went into MRI because I couldn't do echo and I had to learn cardiac MRI. The liver's a difficult organ to raise funding for, both in research and in clinical practice, because it doesn't have the cachet of the heart or the brain. However, the liver is a vital organ in terms of it metabolizes most of the cholesterol in the body in different ways, depending on your state of health. And so actually, if you have liver disease, it is a treatable risk factor for heart disease. Aha, suddenly the British Heart Foundation and the American Heart Association are interested in that, and I can effectively come home. So liver disease to me is not just a predictor of liver-related outcomes, but also of cardiac outcomes and, during the pandemic, COVID-related outcomes. So this was published in May this year. So effectively, if you had liver inflammation, you are more likely to have heart attacks, incident heart failure, or cardiac hospitalization. Now that should be pivotal for those of you involved in cardiovascular outcome studies. We've also been part of groups, including with Oxford and with Imperial and others, that showed that quantitative multiparametric MRI across organs enables the diagnosis of multi-organ disease. Now, the nature of specialist UK hospital training is we come in with a cardiac hat on, an epidemiology hat on, a nephrology hat on, and so on and so forth. But we all have all organs, hopefully still to some level, functioning in us. So we only have to look in a mirror to see holistic medicine in action. I honestly believe that UK Biobank, because it is not organ specific, is far more valuable than the sum of its parts. And to that effect, and Louise showed some of this earlier, we're part of groups like Calico, like AMRA and others, working to show that the interlinkage between organs takes us back to that Oslerian-style medicine that I was lucky enough to benefit from as a medical student. Now this is how to do no harm in image form. That patient that I showed you earlier has steatohepatitis. But to identify them in a clinical population would take lots and lots of scans and lots of biopsies. So one of my data scientists says this: to biopsy this many people, you would definitely have killed one and hospitalized 18. So UK Biobank, by prioritizing the effectiveness of imaging, has saved countless hospitalizations and possibly some lives. And that's on the clinical space as well as the research. And we're almost finished now, pause the last slide. We're also able to export that globally. So the Dallas Hearts and Minds study uses the same liver imaging that we use in UK Biobank. So we're now able to bridge gaps between countries, compare epidemiology and clinical practice. So thank you very much. Thanks to UK Biobank, and thanks from all the doctors and all the patients now using the scans that you helped us make.